guys, Dr. Sammy here with Eastwood Animal Clinic, and we are going to talk about Chihuahua. We got a lot of clients with Chihuahuas, so here we go. A lot of what I'm going to say here with the Chihuahuas can be applicable to other small breeds, aka dogs that are less than 10 pounds and about Chihuahua size. We're going to focus a little more on the teacup Chihuahuas, which are kind of 5 pounds and less typically, but they can get up to 10 pounds of the actual Chihuahua. So, Chihuahuas, fun little guys. Occasionally they're land sharks. So, sorry, occasionally they are little ankle biters and they'll get you every now and then. And then other ones are super sweet and the sweetest little Chihuahuas that you could ever have, and they're just great. And everything in between. So Chihuahuas are a great little breed. They're very popular here in El Paso, Texas. And some of the main issues that we commonly see that's genetically predisposed in Chihuahuas are a respiratory issue called collapsing tracheas. There are some other variations of that from what are called primary bronchi collapses. Basically, that's just a lower version in the trachea and inside the lungs. For diagnosing those, the absolute best way is fluoroscopy. That's not generally very common and prevalent for most general practitioners, and we usually have to send you guys to a specialist for those. What a fluoroscopy is, it's really cool. It's basically a live video imaging x-ray. So as the patient is actually breathing, you can see the trachea. Windpipe is another way that a lot of clients may understand it, is as they're breathing and they have a collapsing trachea, there's their tube, normal size, and then it collapses and it gets smaller. There are all kinds of variations of collapsing tracheas. We'll break them down by sizes. Is it a 10% collapse or a 50% collapse? For my Chihuahua owners, what you want to look for at home is when are they coughing, when are they having issues? Typical big red flags for collapsing tracheas in these guys are they will cough, have a dry hacking cough when they get excited. Think of when you get home from work, when it's dinner time, maybe when they run outside and play, chase the mailman, chase the cat in the backyard, bird, just run around having fun. That's a big red flag. There are some other things that can be associated with that, so touch base if you're noticing it and you haven't seen a veterinarian. See a veterinarian because heart issues can also present similarly, but collapsing trachea. All of them will be a little different. And another Chihuahua specific thing that is very genetic that we see a lot of here are what's called a luxating patella. So essentially the kneecap falls out of place. When it does that, they will typically carry the leg. Depending on the grade, meaning how severe it is, they sometimes can pop that right back into the groove and run off like nothing ever happened. It's not usually a painful thing, but it can predispose them to degenerative joint disease, aka arthritis. Some patients do it, never have an issue, do wonderful. Others, they get what's called a grade 4 luxating patella, and it gets to the point where they're just always carrying the leg and they cannot use the leg. So if it gets to that point, really the only thing we can do is surgical correction, touch base with your veterinarian. Some doctors are comfortable doing those surgeries, some are not, and we'll go from there. There are all kinds of variations. Some of them are minor and we only have to move what's called the tibial crest, which is you have the top part of the femur or the bottom part of the femur and the top part of the tibia where the knee is. We call it the stifle. The bottom part down here is what's called the tibia. This little thing is called the tibial crest. That's where your patella tendon attaches, and that's part of the problem when we're dealing with luxating patella. Normally, it should be relatively straight in line. Go with these two knuckles and that knuckle. Ideally, they should be straight in line. A lot of genetic luxating patella patients, for whatever reason, they developed like this, and it pulls the patella typically medially, and they get a medial luxating patella. So we have to go in and kind of cut that bone, shift it back into anatomical position, and a lot of them do very well. In some patients, we will do a groove in the front. If they have a very shallow kind of condyle kind of groove right here, we will cut it. There's a few different techniques for that, and deepen the groove and Some doctors will cut it, leave the cartilage, go back, shave it, place the cartilage back down to try and minimize arthritis. Some doctors will cut it out entirely, leave a deeper groove, and it's harder for that patella to fall out if the groove is deeper as opposed to more shallow. Every patient's different. Every doctor will do things a little bit different. Not all patients need both. Some need both. Some need a third correction, and one step at a time with those. So hope that's helpful for you guys. Some of the other proactive things that I will recommend are joint supplements. We use a lot of Vascular Advanced here and had very good client feedback with that. And the goal with that for me is to decrease the progression of arthritis down the road. So instead of getting arthritic at 5 or 6, maybe we get arthritic at 9 to 10. And if we're one of those patients who has arthritis and you have that luxating patella, just need to be reasonable with the surgery and have that understanding that typically we cannot change the arthritic damage that has already been done. So there's that. But we can usually try and fix it and make the leg more functional. Ideally, we try and get to it before the patient is arthritic if it's bad enough. Once again, just follow up with your veterinarian. They should be able to put you down the right path. Hope that was helpful for you Chihuahua owners. And once again, that can extrapolate a little bit across a lot of other small breeds. And I have seen it in a few large breeds as well. So take care, guys. Bye.